Peter Cipriano Centre for Seniors Health is an innovative model of care for seniors. Here's a short tour of this new facility.
The patients will come here. The doctors, the nurses, the allied health team members, the community people, they will come to this center versus making the patients to go to everybody else's office. So that'll make it easier for patients and families, and we'll have a coordinated care plan for them in this center. And it's designed with wider hallways and better lighting and bigger rooms. For people who are a little bigger, we have wider chairs, we have a lift for mobility issues so that you can help people get out of their wheelchair perhaps onto a bed. And one of the highlights is these doors. So we're often with patients for 2 to 3 hours. And so when we're in a room, we want to close a door. And if you look through here, we have some privacy. So now you can't see in. And when we leave, if we shut a door that has no window, patients get nervous. So when we leave, we open the window, and then as we're outside talking, with other team members, they know there's still people here, so they're not scared inside a room. The rule is that the team members sit in the center, and the light is for the patients and their families. So no doctor or nurse has an office here. This is strictly for patient care with a beautiful view, so they get the brilliant outside light. And our workers are in the center space, which we'll have a look at in a moment, and where we talk about cases. So this is a consult room where you might want to talk to a family or have a private conversation. And then we move down with more consult rooms. Right now we only have 2 rooms, and now we have 8 full-size rooms, so we'll be able to see way more people. And then the very last room is a point of interest where we'll go in here to have a look. So this is our treatment room where procedures can happen. And there's a variety of equipment. So if someone got really sick, we could look after them here. If someone needs an intravenous, we can set it up. With the latest modern medicine, there's lots of intravenous therapies for all sorts of cancers and even Alzheimer's disease now, there'll be therapy coming. So we need a place to do that. Minor procedures all can be done in here. So this is the biggest room to allow people to come in and do what they need to do. Typically in the past, people are locked up in their offices, and now they will be able to work here. And so if I see one of my colleagues here, I might say, hey, do you remember Mr. X? Can I ask you a question? Whereas I have to find him, knock on the door, send an email, it takes forever. Whereas now everyone's working. Yes, it'll be a little bit noisy, but we function. Now it's designed similar to a nursing station where it seems noisy and a bit chaotic, but it's actually working all in harmony where all the doctors and nurses are talking about their patients, and there's incredible collaboration because you can see people. And I did that for 30 years on the wards at Sunnybrook, and it worked extraordinarily well. So we wanted to make something similar in our new center. Our gym is here. So this is, we had a gym, this is twice as big. So people are gonna come in here for exercises, therapy, group therapy, and you look outside and it's absolutely stunning when you look out that window in terms of what's going on outside. The only concern is people get distracted looking out this window because it's so beautiful, they forget about their exercises. I mean, it is an incredible garden, and this is part of the Veterans Center, and so people have worked on this for decades to make it as beautiful as it is. So it's a stunning space and a stunning window. Down here, we have rooms for recreational therapy, so there can be watercolors, there could be knitting, there could be other activities, gardening, and they have the outdoor space. So recreation therapy is a huge part of getting people better. It's just not about going for a walk, it's all sorts of things, and this is critical to get people's minds going and people interacting again. There's another consult room when you need a bit of privacy, so someone can go in here to talk to patients. Another one over here, because there's a lot of one-on-one therapy that works with here. The occupational therapists, social workers need a private, quieter space to go with patients and families, so this was designed for that. That's another entrance to the team room, so you can access, that's that central space we were just in, so you can get it from all places. Another occupational therapy room here. So again, working on function. Our goal is not just to make a disease better, we have to make a person better. And that's where the functionality is important, and the recovery and rehab occurs on this side of the building here, and this is what makes all the difference. So people learn to dress themselves, to walk, to cook, whatever. And so that's what this space is about. Another consult room here. And then there's a patient lounge. And so in this space, there's a kitchen where we can also test people's skills and how they can cook. and look after themselves at home. Because you come to the hospital and you have pneumonia, you go home, but people may not be able to look after themselves anymore. So we can check all these things here and make sure, and if they can't, we'll provide better care